In this video, you will learn about medical terminology basics. How to read and understand the medical terms. How to build terms. In the end of the video you will be able to test yourself in medical terminology basics at the link in description. Imagine that you are reading some medical book or watching a medical information episode. In that moment you see some strange words that you find it difficult to read and understand. What you may not realize is that these medical terms are variations of Greek and Latin terminology. When we see medical terms we should look at them differently from other words in the English language. To understand the medical terms you must break these big words into smaller components, understand the meaning of those components, and then create an overall definition for the medical term. Now you understand the meaning. In this way you can study terminology. Basic knowledge of anatomy and physiology is essential for the understanding of these medical terms. There are 5 components to medical terms. Typically a medical term will use 2 or 3 of these components. There is no rule that states how many parts a medical term must use. Your goal is to break down a medical term into its component parts, then define each part separately. These components were derived from Greek or Latin, so when defining these parts we are in essence translating them to the English language. This lecture does not cover all the medical terms that have ever existed. Instead, it will prepare you for any terms that you may face by teaching you how to translate their component parts. The root is the foundation of the term. It is the basic essential part of the word that other words are derived from. Think of it as the root of a tree. Like the roots of a tree holding it in place. The root of a medical term holds the main meaning of the word. You are probably already familiar with some roots of medical terms that you've probably heard from friends, family, and television shows. The following are examples of roots. The term cardiology. Its root is cardio. Plusology, which means study or branch of knowledge. So it means study of the heart. You can apply this rule on the following terms. It's like puzzle. You must understand the rules only. The combining vowel is a vowel that is used to link the root to its suffix. In most cases, it is the letter O. The combining vowel has no meaning, and therefore will not affect the meaning of the term. This is an example of how the combining vowel is used. Notice that in order to attach the root enter to the suffix logy, we must use a combining vowel. In this case, it is the letter O. The combining form. The combining form is the root plus its combining vowel. The meaning of the root is not affected by adding the combining vowel. Let's use roots from previous examples. Now we understand the combining form. The prefix. The prefix comes before the root and modifies its meaning. Not all terms will have a prefix. These are some examples of prefix. Let's try those prefix on term gastric. To make it simple, the prefix sub mean below. So when we add it to gastric, which means stomach, it's form the term subgastric. That mean below the stomach. Let's try this on another prefix. The prefix epi. Epi mean above. If we add them together, epi, with the term gastric, it will give us epigastric. That mean above the stomach. As the previous examples, we can form term that hold across the stomach meaning. That term is transgastric. The suffix rules are similar to the prefix rules. They modify the meaning. And not all terms will have suffix, except that rules. The suffix came in the end of the terms. Let's apply the rules on these suffix. As we mentioned before, the suffix logy means study of. For example, I want to talk about study of blood. So I bind logy to hema, which mean blood. That will give me hematology term. Study of blood. Itis is a suffix that means inflammation. So when you see any term end with itis, that means inflammation of that thing. For example, enteritis. Enter in terminology means small intestine. So the term enteritis mean inflammation of the small intestine. Now you may ask, why we add o before the suffix logy? But we don't add anything before itis. To understand that, you must know the basic rules of building terms. Rules to medical terminology. There are 5 basic rules to medical terminology. If you can remember these rules, understanding the terms and their meanings will be much easier. Rule number 1. If a suffix begins with a vowel, drop the combining vowel. The following are 2 different examples to illustrate this rule. In the first example we'll come up with the medical term that means pertaining to the stomach. The suffix for pertaining to is ek, and the combining form for stomach is gastro. Now we need to combine these parts. Because the suffix ek begins with a vowel, then we must drop the combining vowel in the combining form gastro. Therefore we drop the letter o. In the second example, we look at the definition study of the stomach. Because the suffix does not begin with a vowel, we can keep the combining vowel. Rule number 2. Read the parts to define the term from back, then to the beginning, and follow through. You have probably noticed by now that when we define a medical term, we begin at the suffix, then look at the beginning of the term, and follow through. The following is an example of this rule. Define the suffix, followed by the prefix, and then follow through. Not all medical terms will use this rule. However, the rule will apply 90% of the time. Rule number 3. Keep the combining vowel between roots. Some medical terms have more than one root. When attaching roots together, we leave the combining vowel between them. In this example we have combined the combining forms gastro for stomach and entero for small intestine. Because we have 2 roots in the term, gaster and enter, we must leave the combining vowel between them. In this case it's the letter O. Rule number 4. List the roots in anatomical order. By now you've already used this rule without even realizing it. If you look at the previous term, gastroenterology, the roots are listed in anatomical order. The stomach comes before the small intestines in the order of the organs of the gastrointestinal. It wouldn't make sense to have the term enter a gastrology, because the intestines are not before the stomach. Rule number 5. Not all terms break down exactly. This rule knowing when to define a medical term literally, or use a special definition. Unfortunately, this knowledge only comes with practice and memorization. You will notice that common sense will become useful with some of these terms. To illustrate this rule, we will look at the term orthopedic. You, or a friend, may have been seen by an orthopedic surgeon or orthopedic specialist. Usually people associate this term with bones and joints. However, if you break the term down literally, that doesn't make sense. If using the basic rules of medical terminology to define this term, then the definition would be pertaining to a straight child. It is for this reason that we must create special definitions for certain terms. Now you understand the root, the combining vowel, the combining form, the prefix, the suffix, and the basic 5 rules to medical terminology. Don't forget to test yourself. Visit the link in description. And if you found this video helpful, support us with like and subscribe. And share the video with your colleagues. Thank you for listening. Goodbye.